Hello, I'm Dr. Bryan D Menezes, Director, Smile Dental Care, Bangalore. I specialize in dental implants and cosmetic dentistry. I've been practicing dental implants, including zygomatic implants, for about 15 years in Bangalore, India. Dental implants are one of the modes of teeth replacement. This is the closest we can come to a natural tooth. Your natural tooth is always fixed, and dental implants are the only possible option where we can fix an artificial tooth in the closest manner with the root and the crown portion to your natural jawbone. The natural tooth is always anchored to your jawbone. It is fixed. Dental implant is the closest replication of that fixed natural tooth. So what happens in a dental implant is it's a replica of your tooth root. A tooth has two portions, a tooth root which is embedded within your jawbone and a tooth crown which is seen in the mouth. When a tooth is lost, the entire tooth and the root portion is completely out of the jawbone, and the dental implant replicates your tooth root which we place inside the jawbone. It gets integrated and anchored to the jawbone, and taking support from this dental implant, we replace the entire tooth and the tooth crown as well. Any person with the missing tooth above the age of 18 is a good suitable candidate for the dental implant, provided they are healthy, their bone volume, the bone quality is moderate to good, and they do not have any severe medical conditions. There is no upper limit for the dental implants as such, but we do have to do a thorough analysis and the medical checkup to see multiple parameters which will help us analyze whether a candidate is suitable for the dental implant or not. So any person who has a missing tooth but above the age of 18 is a suitable and a good candidate for dental implant. Before the dental implant, there were two modes of tooth replacement. One was the denture, which was a removable denture, which is even called as a tooth set. People used to wear it during the daytime, and you have to remove it in the night, keep it in the water, and next day wear it again. This used to be messy, this was very uncomfortable, and you cannot really bite hard food with this, and sometimes when you're talking to somebody, it can come out. That is embarrassing in the social circle. The second option was a tooth bridge. Now for tooth bridge, if you have a missing tooth, we take the support from the adjacent teeth and we use them as pillars and we replace your missing tooth. Now the dental implant nullifies all this. Dental implant is one single structure where an artificial titanium dental implant placed in place of your original tooth root, and taking support from that, the entire tooth root and the crown portion is replaced. It does not harm your neighboring teeth, it is not removable, it does not come out, and it lasts almost a lifetime. The long-term benefit of the dental implant is it replicates your natural tooth and it behaves exactly like your natural tooth. It keeps the proprioception, that's the sensation around the tooth structure and in the gums, active. It keeps the integrity of the jaw alive. It does not let the shrinkage happen. Your gum integrity, the jaw integrity, your cheek symmetry, everything stays the same when we place a dental implant. There is no major potential complications of the dental implants. However, if there is an infection, it can affect your natural tooth also, it can affect your artificial implant as well. So if the dental implant is taken care well, so there are many benefits and there are very less complication which can happen in the future. The most common dental material used for the fabrication of the implants are titanium, medical grade titanium. So this is a non-metallic biocompatible material which engages and anchors to the jawbone without any complications, and it becomes a part of your body when it is left inside. Now the average cost of the dental implant differs a lot. It differs on the type of the implant, it differs on the country of the origin. On an average, you can say a good quality dental implant in India may cost you around 30 to 35,000, but it may even start from about 15 to 18,000 as well. Your doctor will check you thoroughly, analyze the bone condition, bone volume, your overall medical health, and if you are a suitable person for the case of dental implant, they will inform you about what type of the dental implant is suitable for you and how much it's going to cost, what is the duration of the treatment, what are the benefits, and what to look for in the future.